Hi, everyone, and thanks for joining this talk about therapy dogs in the community hospital setting. You notice a picture. These are dogs without handlers. We'll talk about the whole package. I'm Russ Weinberg, Program Coordinator for Washington Hospital Outreach of FUR, which we call WOOF. And we're located in Fremont, California, and in the Bay Area. At the end of this lecture, a few goals for you, and I hope that I'm able to convey this clearly. You should be able to explain the possible advantages and disadvantages of different types of hospital dog therapy programs. There's a lot out there. I would love to see consistency, but there are lots of variables that would go into different types of programs. Explain the elements needed to successfully establish a dog therapy program, and also to maintain that program. So there's a lot that went into establishing the program that we have at our hospital, and also maintaining it in a professional way and a way that we hope to help with outcomes for patients and help with our community at the hospital. In my research, I found that therapy dogs have been around a lot longer than I thought they had in institutions. And that picture that you see on the screen is Florence Nightingale. And she was one of the first advocates of having small animals interacting with patients of different ages, I think mostly children, in a psychiatric institution. And that was sort of the roots of what we do today. In the 70s, there were a couple of doctors at Ohio State University that started a program themselves, and they expanded use beyond children, also with psychiatric patients, to visiting with adult patients. In the 70s also, Elaine Smith started a program to train teams towards visiting institutions. And what's memorable and notable about this is that this started towards a standardization or a concept of training teams before they actually went into institutions, and hopefully helping to inform what we do today. You'll see that in this particular slide, I say, "Hi, I'm Russ. It's nice to meet you." I've been doing this for about 7 years, and what I've noticed is that a lot of times people focus on our furry friends as they come into the hospital or into different venues where I do therapy dog work as part of a team. And what's interesting is that I think it's important that we introduce ourselves just beyond the dogs. People will have tunnel vision. I've had physicians in the intensive care unit that will actually say, "Hey, Russ, I saw a wonderful, beautiful Portuguese water dog in the intensive care unit the other day." And I'm thinking this through and going, Dr. Smith, I'm going to make up the last name, but Dr. Smith, you mean that you saw our team? But again, it's tunnel vision towards the dogs. Obviously, we don't round or have the dogs round without us. I've been a Pet Partners evaluator since 2021. The genesis of me becoming an evaluator, I found that there were not a lot of teams in the Bay Area to supplement our program. And this was just an opportunity for me to sort of engage in the community and hopefully get more teams for our hospital, but also for other programs as well. So we do certify register teams at the hospital. And this has helped because when people are done with their evaluations, I'll let them know there may be opportunities to join our team. And that's after my co-evaluator and other members of our team have had a chance to see them and give input. So it's a nice opportunity for all of us. And we've gotten quite a few teams this way, which is nice. I've been the coordinator for the program since inception, which was 2019. My background is very varied. So I came through, my father was a hospital administrator at New York City Health and Hospitals. And in that, I've been around hospitals my whole life. At some point, I was a hospital manager. When I worked as an MICU paramedic in New Jersey, we were hospital-based. I was a manager of paramedics. I was also an advanced cardiac life support instructor. After being as a paramedic, I moved on to being a pharma sales rep in pharma and biotech, and then went on to be a national sales trainer and a marketer. Other things I do since retirement, which was a year and a half ago, I also am a singer. So I sing with choral groups as a soloist, and I've also started singing in operas. I had said at the onset that hospital-based therapy dog programs take on many forms, and there's an iteration where you have paid handlers and iterations where you have volunteer handlers. There's iterations where you have people who manage programs that are paid, and iterations where they are not paid or volunteers. I view us all as professionals, regardless of whether we're paid or not. I've always viewed that. When I started as an EMT, I was a volunteer to start and then became a paid EMT and then a paid paramedic. Certification, some programs, teams will insert themselves into hospitals as that are AKC registered or certified through an AKC recognized organization, such as Pet Partners or Therapy Dogs International, or other. So sometimes hospital programs are, we'll find that we have local humane societies with their own standards and their own guidelines that will insert into hospitals. And I'll talk in the next slide about some advantages, disadvantages of these different systems. So access to the hospital, again, can be affiliated. In the case of our program at Washington Hospital, it is affiliated or not affiliated. As I said, other teams inserting. There's an unknown. So I would love to see standards within all hospital dog programs, but there's so many variables right now that there's not standardization. And we all come into hospital dog therapy programs. Things to consider if you're thinking about starting a program or what your program could look like is cost. So there's cost to the institution, such as if you do have a paid handler or perhaps a canine companion dog, which some hospitals I've talked to have. And there's cost for that team, and it needs to be funded. So the question is this billable? And it may or may not be, or most likely not. So there has to be funding for a program if you have paid professional staff. There's also cost or opportunity cost to teams. So I'm retired, and many of our teams at Washington Hospital are retired, but there's a cost of certification or registration. There's a cost of maintaining exams, having dogs be examined by veterinarians in every year, having their annual immunizations, having annual fecal tests. So it's cost to the team as well as opportunity costs for their time. New teams, hopefully that's not a barrier for them to join. I'm finding that we are being able to recruit teams post-COVID, which is nice. But again, most of them being retired, not all of them. We do have someone who will be going off to medical school shortly. It's a great team. So I would imagine they'll drop out when they go to medical school. There's risk. There's inherent risk to programs, and that's the inherent risk of having a dog or an animal in the hospital. So they need to be reliable, predictable, and controllable, and make sure that we have the teams well positioned for success. But there's also a risk to how have you trained the teams and how have you standardized your training? So is that through a nationally recognized group? Is it done solemnly within a local organization? So that risk should be evaluated as well. Washington Hospital itself is a community hospital with expanded services, meaning that community, and I would say heading towards a regional hospital. It opened in 1958. It's licensed as a 450-bed, 15-bed acute care hospital, meaning that the hospital could have up to 415 patients. The typical census is somewhere around 200 patients, perhaps greater during flu season or different types of the year when there are more respiratory illnesses. The hospital has strategic relationship with UCSF Health and UCSF Benioff Children's Hospitals for pediatric services, for oncology services, and for cardiac surgery services. So it's a nice partnership as a hub-spoke model where UCSF is a tertiary care hospital. And then recently, Washington Hospital has been approved as a level 2 trauma center. Interesting to say, you would normally think that with CEO support, this program was supported at the onset by the CEO of the hospital. She's a very big supporter of pet therapy, very much believes in it. So she endorsed the program in April of 2017. That being said, it took a while for the program to start. What needed to happen is that objections needed to be identified, and they were identified by a clinical nurse specialist, was really from the hospital, from the intensive care unit, was someone who shepherded the program through the internal clinical workings of the hospital. So I'm a volunteer, she's clinical staff, and that made a very, very big difference to success of having the program started. Objections that she identified is the chief nursing officer was concerned the program would take her time away from her other responsibilities, and that's realistic to think about. ID physicians were worried about, in fact, controlling infection prevention standards, and they wanted to make sure that these standards were followed all the time. The director of volunteer services had concerns about how we would recruit teams and the time required to do that, and the need for education for the teams. Risk management for the hospital wanted to ensure there was liability insurance for the handlers and there'd be minimal liability and risk to the hospital. All these things are very intuitive. Well, it took 2 years for the program to be approved eventually, even with CEO endorsement. Once the objections were identified and addressed, the approval was in April of 2019. So what my best advice is, have tenacity and perseverance, because the program is so worth it. There are so many great stories I could share with you guys, but it would take more than a minute or two. But I can definitely tell you that there's so many positive outcomes, not only for the patients, for the providers, as well as for visitors to the hospital. So there's a lot of win-win-wins, as well as for the handlers and the dogs themselves. It's a lot of wins for everybody. WOOF program management. It's important to identify in the program who's responsible for what, and that is clearly delineated. So within our program, the WOOF program coordinator, which is what I do as a volunteer, I interview and evaluate new teams along with the volunteer services director. I am responsible for ongoing compliance monitoring to make sure all teams are obedient to and following hospital policy. And that we'll go into a future slide, go into what that looks like specifically. Reevaluate existing teams. What I will do is, in an annual basis, as teams have joined on their anniversary, I will go, or somewhere close to their anniversary, I will do a shadowing exercise with them just to see how they're doing and make sure that if they have any questions about policies or other things, that I can also see that they're being compliant to policies. I am liaison to the volunteer services and to the clinical staff. So it's sort of a dotted line connection to both to make sure that we have that sort of three-way communication. The volunteer services director interviews and evaluates new teams as well, is responsible for hospital orientation for new volunteers, and also the vetting process, which includes background checks, which are in addition to any background checks would be conducted by any certifying or registering organization. The clinical staff liaison is liaison to hospital management, creates and revises hospital policy. And we do look at the policies on an annual basis. There have been minor changes over the years, but very minor changes. And they seek feedback from hospital staff. Process for joining the WOOF team is fairly straightforward, and it's done in a stepwise fashion. Teams must be, or the handlers must be, at least 18 years of age. As I mentioned, most are retirees, but not all are. They need to be vetted by volunteer services, and that is done in the initial interview process and then through background checks. They need to also have immunizations that are required by the hospital. They go through a hospital orientation, which is required for everyone, regardless of what their function is within volunteer services. They need to be either a pet partners or TDI trained and evaluated, and successfully complete that training and evaluation. And then they also need to complete a shadowing exercise. And this, teams will follow me through our rounds when I go and see patients. And then it's a good time for me to review policies with them and to walk through what we do on a day-by-day basis. And then after that, I will follow them on a separate day with their dogs. So they'll be following with me with one of my dogs. I have two in the program, two Portuguese water dogs, Ringo and Molly. And then on another day, I will follow them. In order to successfully join the WOOF team, they have to complete all steps. If for some reason in the very beginning, end, or middle, there's some issues or problems, then we stop the process. It hasn't happened very often, which is great, but it's important to, as I said, compliance and success of the program. All WOOF teams are required to have current certifications, immunizations, and I've broken the slide down between dogs and humans. So the dogs must be under a veterinarian's care, be parasite-free, on a flea control program, and that is done through an attestation that will have them sign a form saying that they have given flea and are giving flea control medications to their dogs. And we ask them to list what that is. Obviously, this is not something that we can do by direct observation, but it is good to have it documented and also to reinforce that it needs to be done. They need to be free of lesions or hair loss. If in any case the dog is a hot spot or something of the sort, that's not a day that they could visit, and that needs to be cleared up before they would do any visiting. They need to be bathed and have reasonable oral hygiene. When I say bathed, the hospital policy is 24 hours prior to starting their visits. Their nails need to be trimmed and filed. They must maintain an appropriate temperament and have a current, and the team must have a current certification with Pet Partners or TDI. For the human, they need to have current immunizations as well, two-step TB test, as well as flu vaccines and COVID vaccines as indicated and needed. If there's a medical reason for them not to, then they'd be required to wear a mask at all times. On the subject of masks, hospital policy right now is that we do not have to wear masks. I choose to, in that some of our patients are immunocompromised or immunosuppressed, especially with the oncology areas. We do visit the outpatient infusion center as well as the medical oncology floor. And what we, when I see those patients, I think it's important, I stress this to the teams as well, that we try to protect the patients and ourselves as much as possible. The teams will have an annual review, shadowing exercise. I think I mentioned this before with me. We'll document compliance and also answer any questions they have. And as well as the dog, the handler must have current certification with their dog with Pet Partners or TDI. Before visiting the hospital, you see a very cute picture of Ringo. That is one of my dogs, and he is pet therapist number 2 for the hospital. One was the CEO's dog. The dog must be on a leash that's a maximum of 6 feet, not a flexi leash. I just don't think there's enough control that a dog should be on a flexi leash. Name tags must be worn at all times while in the hospital. That's for the handler and for the dog for a few reasons. One is that we don't want people bringing dogs in that don't belong in the hospital. We don't know whether they're immunized. We don't know whether they're predictable or reliable, or whether they'd be under control of their owner. The exception to that would be under the rules of the American with Disabilities Act. The dogs that are service dogs are allowed in the hospital. It's a very rare occasion that would happen, but by ADA standards, they are allowed in. Before going to the hospital, each team should check the dog for cleanliness and fleas, make sure they're in a generally good mood, as in good temperament for both of them, and check general health prior to each visit. They must be, both the dog and handler must be free of contagious diseases. And if they've been exposed to a contagious disease, they should not go and do rounds or visit the hospital until that is cleared up. Dogs should be given an opportunity to pee and poop. So that's for the dogs and handlers, that it's good just before they start rounds that they're ready to go. And there's no specific area in the hospital that we have, or outside the hospital rather, that we have them do this. Usually off to the side of one of the outpatient clinics is a good choice. So before making patient contact, there's a few things that we have the teams do. Teams are requested a few different ways. One is through our electronic health record system called Epic. And when patients are admitted to the hospital, part of a checklist that the nurses will speak to the patients about is asking if they want pet therapy visits. So that is the most common way we know about requests. And when teams tell me they're going to visit the hospital, I will let them know what room numbers have requested visits. I do get a report with patient identification information. I don't pass it on to the teams, as that is HIPAA protected. So I'll let them know what rooms they can visit. It's not really unusual at all that we'll find that the requests by RNs and MDs while we're on the unit. Visits to the staff, I think, are just as important as visit to patients. You could say there's definitely a downstream effect when the staff is feeling better and it energizes them. And Ringo specifically, one of my nicknames for him is Eileen. He'll lean into the nurses and it just smiles for them. But then again, one of our primary focuses, of course, is visiting patients as well. So it's visiting patients and staff, but they may say, can you visit room 200 or something like that? Before we make that visit, we need consent. And the other one is request by patient and family. I've had in the hallways of the hospital, I've had family members say, can you see my mom in room 200? And our policy is I tell them yes, as long as it's okay with the nurse. And what I'll do is then go up to the unit when we're making rounds, make sure it's okay with the nurse or the charge nurse, and then we will visit the patient. After the patient's nurse or charge nurse has okayed the visit, we reconsent the patient, even if they've given okay on Epic, just to make sure they still want to visit. There's many times in the hospital patients are sleeping. If they're sleeping, then that's a pass on that room for the day. I use this term pause, pause, pause. So before teams go into patient rooms, we ask the handlers to clean their hands with either soap and water for at least 20 seconds at a sink, or use alcohol-based product that's outside of all the rooms. And that's important as they go in the room as well as they go out of the room. When they get to the room, we ask the patients to clean their hands with alcohol, or we'll all carry little bottles of cleaner for the patients to clean their hands. I put down the dog's paws here in the slide is that on occasion, we'll have patients request for the dogs to come on the bed. That is allowed as long as it's a direct request from the patient. And it's okay with the nurse, of course, but we'll put a sheet on the bed, let the dog go on the bed. And if they have gone on the bed, we ask the teams to clean the dog's paws with either a baby wipe or chlorhexidine wipe, just to clean their paws. That being said, when they're off the bed, I'm sure there's lots of things on the floor, but it's a good step and best practice. If a patient is on contact isolation, there are signs there'll be, as part of our Epic reports that's noted, as well as there are signage by the rooms. There's no visit allowed. What we can do, and what I've done before for patients on isolation, is I'll step a few feet away from the threshold or door of the room, and we'll just let the dogs wave from there. We have nice little trading cards that are part of the WOOF program with pictures of the dogs and fun facts, such as Ringo likes to watch Netflix, and it tells them that he's a Portuguese water dog and his age. So we'll just give one of those cards to give to the patients. And it's amazing that little kindness goes a long way. So that's also a nice best practice. Those little mementos for the patients or families, and for the staff, they ask for them as well. So WOOF patient requests far outnumber our current actual team visits. You'll see 1,500 requests, and this was from a period of July of last year to July of this year. There were 1,500 requests. There were 415 visits. Now that's all comers, so that 415 visits might be Epic requests or EHR, electronic health record requests, or they also could be walking down the hall, can you see my mom? Or a nurse says, can you see room 200? So those are all comers. So I would love to have more visits, and as we have more teams, and we can hopefully increase and improve that number. So currently there are 9 WOOF teams at the hospital. It's growing, which is great to say. The feedback has been great in the hospital uniformly. There's a very unusual that someone says, I don't like a fluffy dog. So it's been very nice. The program's successful. Patients, staff, and administrators are always asking for visits. That's from Kathy W., clinical nurse specialist in critical care, who was the program originator. From the infectious disease doctor, patients and caregivers alike suddenly smile and seem to light up, and they see this therapy dogs. The patients talk about their visits for days and find it to be a truly positive experience at the hospital. And in the hospital, there's not, you're looking for rays of sunshine. So this is a nice ray of sunshine. From one of the nurse managers, for those few moments spent with our human and dog volunteers, each patient and staff member are able to experience a decrease in their stress levels and feel more relaxed. The volunteer dogs are so well behaved, friendly, and bring such a warm energy to the floor. For folks stuck in a hospital bed days or weeks on end, this can be an invaluable reminder of the outside world. Some of our patients are in the hospital for weeks or months. Some are just for a few days. Especially if we see that patients have been in the hospital for a while, we'll do our best to try to go see them. Key takeaways for success. And one is just to be patient. Establishing a program takes time. So be patient with the process and make sure everyone's involved. And everyone is given an opportunity to speak and voice their objections so they can be addressed before the program starts. Identifying those key stakeholders will help with that. And then it's important to identify who does what. Roles and responsibilities. What does a volunteer manager do versus a program coordinator do versus what the clinical liaison does. Reaching out to other programs has been great. I've done that. I'll give a shout out to Kathy Bennett, who I called a while ago, and she told me, learning I'll pass on is that when we approach elevators, I ask the teams to stand about 5 feet away from the elevator, and let people exit the elevator. If you're viewing this presentation, you probably like dogs, and you are most likely have a therapy dog team, but not everyone does, especially in our catchment area. We have, I would say, almost the United Nations in Fremont, California. So we have many different cultures. And in some cultures and in some families, patients or visitors might be scared of dogs or staff. So it's important to honor that and make sure we give them room. So it's not a busy hospital, but nonetheless, it's a good best practices. We'll stand about 5 feet from the elevator, let the door open, let everyone exit, and walk the dog to the back of the elevator and stand there so people can choose to come on the elevator if they want to. Having due diligence for record keeping, I can't say how important that is. Being that we do have a hospital policy for our program, which is important to have for the WOOF program, we need to be compliant to it. And the Joint Commission, TJC, will come around every few years to certify the hospital for Medicare reimbursement. And part of that is review of policies and procedures. In mock surveys at our hospital, in 2 mock surveys, sequential mock surveys, the team pulled out WOOF records to check for compliance. So I would say that's important to do, not only for success and risk management of the program, but also, as I said, for the Joint Commission. So all of the above. Here's some selected resources for you. I can say these are not necessarily part of this presentation, but they might be good if you're looking for proof sources for your program and starting a program, or someone wants more information about hospital-based therapy dog programs. This second one, Canine Assisted Interventions in Hospitals, has a lot of good information in it. It's an article from the NIH, and I'd recommend reading that as well as these others. The next slide is just questions. You will see this is not Ringo. This is Ringo's sister, Molly, another Portuguese water dog. She's a wavy. And if you have questions, please feel free to reach out. Thank you so much for taking the time out of your day to view this presentation. I hope it was helpful to you. But if you have questions, call anytime. rdweinberg59@gmail.com is my personal email. You can call. I will probably not pick up the phone just because there are so many people that call that are spam or of that sort. So, but I will call you back. So 925-989-9624 if you just say you have questions about this Pet Partners presentation. My hospital email is Russell, RUSSELL_Weinberg @WHHS.com. Excuse me, .com. Hope you're having a great day. Again, thanks for seeing this presentation, and take good care and enjoy your hospital-based program. Take care and be well.